You'll have to excuse me for splitting this into two videos. My camera will not allow me to take video that lasts longer than 10 minutes. So we're going to pick up where we left off with spinal cord injuries. Um, spinal cord injuries and treatment with adult stem cells has had moderate success. They've coupled the use of physical therapy along with the injection directly into the spine of these patients, and they've actually shown significant clinical improvements. In fact, quadriplegic and paraplegic patients, two of them in one study, regained the ability to walk, and that in itself is enough to motivate or push stem cell research further along. You've also seen increases in the ASIA scores, which is the American Spinal Institute Association, and a number of other improvements. We're going to go on to our next neurodegenerative disorders like ALS, amyotrophic lateral sclerosis, Alzheimer's, and Parkinson's have all been treated with adult stem cells. Moderate successes in these, maybe almost inconclusive. However, these diseases are complex. They're not simple. It's not a damaged tissue necessarily. It's not one type of interaction. And as our procedures improve, we may find ways to maximize the effect of stem cell treatment, thereby improving the overall treatment provided to these patients. However, we're just getting off the ground with stem cell research, and in the future, this type of research holds a lot of potential. Embryonic stem cells, I've seen one study, macular degeneration, with 2 patients only, direct injection into the eye. And these show moderate improvements, however, nothing to write home about, just moderate improvements. In summary, what I found is that adult stem cells are being much more widely utilized for the treatment of many diseases, and they're working. So as we go into the future, we have to recognize that adult stem cells do not, number one, don't bring up the same amount of controversy as embryonic stem cells. And number two, adult stem cells are a little easier to understand. And as we progress, we can start with adult stem cells and maybe transition into the use of embryonic stem cells for treatments of these untreatable diseases in the future. So I think I've covered pretty much all I came to cover today. Thank you very much for your time.